Welcome to our exploration of pharmacokinetics, a crucial field in medicine and healthcare. This presentation will guide us through the fascinating journey of how drugs interact with the human body. We'll explore the processes of drug absorption, distribution, metabolism, and elimination, collectively known as the ADME framework. Along the way, we'll delve into the mathematical models and visual aids that help us predict and understand drug behavior. What do you think happens to a drug once you swallow it or it's injected into your body? This question serves as the foundation for understanding how drugs move through the body and how mathematical models help us predict their behavior. Let's begin by breaking down the ADME framework, which consists of 4 key processes: absorption, distribution, metabolism, and elimination. This slide presents these processes alongside a visual representation. Absorption. Absorption refers to how drugs enter the bloodstream through various routes, such as oral ingestion, intravenous injection, or inhalation. Absorption is critical because the method of administration influences how quickly and efficiently a drug begins to act. Distribution. Distribution describes how drugs spread from the bloodstream to different tissues and organs. Blood flow and the drug's ability to bind to plasma proteins like albumin play significant roles in this process. The diagram illustrates branching blood vessels and how the drug reaches different areas of the body, with some tissues receiving more of the drug depending on perfusion. Metabolism. Metabolism is the process where drugs are chemically modified, primarily in the liver, to prepare for elimination. Enzymes like cytochrome P450 convert drugs into active or inactive metabolites. In the picture, the liver is highlighted as the main site of metabolism, showing how this organ transforms drugs for the next stage. How do we determine the concentration of a drug in the system at a specific time? This question helps us explore how mathematical models are used to predict the behavior of drugs in the body, ensuring effective and safe treatments. The first picture represents the one-compartment model. It assumes that the drug is evenly and instantly distributed throughout the body. This model simplifies drug behavior, providing practical applications for many drugs with rapid distribution, such as antibiotics or pain medications. The second picture illustrates the two-compartment model, which accounts for more complex dynamics. It divides the body into 2 interconnected compartments: the central compartment, including blood and highly perfused organs, and the peripheral compartment, such as muscles and fat. This model helps capture the behavior of drugs that require more detailed analysis of distribution and redistribution. One-compartment model, simplifying drug distribution. The one-compartment model assumes that the body acts as a single uniform unit where the drug is evenly and instantly distributed after administration. This simplification makes it practical for many drugs that distribute rapidly. The equation for the one-compartment model is C of E equals VV E minus KT. Here's what each term represents. Minus C of T, the concentration of the drug at time T, showing how much drug remains in the body. D, the dose of the drug administered, determining the initial concentration. V, the volume of distribution, representing the extent to which the drug spreads in the body. A larger V leads to a lower concentration. K, the elimination rate constant, describing how quickly the drug is removed from the body. Minus KT, the exponential decay factor, showing the natural reduction in concentration over time. The negative exponent indicates a decrease in drug concentration as time progresses. Why might some drugs require a more complex model than a single compartment? Certain drugs exhibit distribution patterns that cannot be accurately captured by the one-compartment model. Factors like slower drug movement into tissues, redistribution effects, and variable perfusion rates require a more detailed approach, leading to the use of models like the two-compartment model. Two-compartment model, a more complex approach. In this model, the body is divided into 1. Central compartment. This includes blood and highly perfused organs like the heart, liver, lungs, and kidneys. These organs receive a high blood flow, resulting in rapid drug equilibration. In the image, the central compartment is depicted with a strong connection to the site of administration, showing how drugs are distributed quickly to these areas. 2. Peripheral compartment. This consists of tissues and organs with slower drug distribution, such as muscles and fat. The image illustrates the peripheral compartment as a secondary area where the drug moves more gradually, with arrows showing the flow between compartments. Central compartment. The central compartment in the two-compartment model represents areas in the body where a drug is rapidly distributed upon administration. This primarily includes the blood and highly perfused organs like the heart, liver, lungs, and kidneys. These organs receive a high blood flow, which results in rapid drug equilibration. The accompanying picture highlights these organs connected through the circulatory system, illustrating how the drug quickly reaches and distributes within this compartment. The equation for the central compartment is dx1 dt equals minus k10x1 minus k12x1 plus k21x2. Let's break it down. Minus x1, the amount of drug in the central compartment, representing blood and highly perfused organs, k10x1. This term represents the elimination of the drug from the central compartment. The negative sign indicates that this process decreases the drug concentration in the central compartment as it is removed from the body. K12x1. This term describes the transfer of the drug from the central compartment to the peripheral compartment. The negative sign reflects the loss of drug concentration in the central compartment during this transfer. K21x2. This term represents the return of the drug from the peripheral compartment to the central compartment. The positive sign indicates that this process increases the drug concentration in the central compartment as the drug redistributes back. Peripheral compartment. The peripheral compartment encompasses the tissues and organs where drug distribution occurs more slowly. These include muscles, fat, and other less perfused tissues. Drugs initially accumulate in the central compartment before gradually transferring into the peripheral compartment. This movement creates a concentration gradient. The slide explains that the distribution of a drug into the peripheral compartment affects the overall duration of its action. Drugs in this compartment will eventually release back into the central compartment, prolonging pharmacological effects over time. The equation for the peripheral compartment is frac dx2 dt equals kl12x1 minus k21x2. Let's break it down step by step. x2. This represents the amount of drug in the peripheral compartment, muscle, fat, and other less perfused tissues. x1. This represents the amount of drug in the central compartment, which includes areas like the blood and highly perfused organs. K12x1. This term shows the rate at which the drug moves from the central compartment, x1, to the peripheral compartment, x2. The positive sign indicates that this process increases the drug amount in the peripheral compartment, K21x2. This term represents the movement of the drug from the peripheral compartment, x2, back to the central compartment, x1. The negative sign here indicates that this process reduces the drug amount in the peripheral compartment. The equation balances the drug's movement into and out of the peripheral compartment. The net change in x2 depends on the rates of these two processes. In first-order kinetics, the rate of drug elimination is directly proportional to the concentration of the drug in the body. This means that as the concentration decreases, the rate of elimination slows down as well. The process is described by the equation dc dt equals minus kc, where c is the drug concentration at a given time, k is the elimination rate constant, and the negative sign shows that the drug concentration decreases over time. The solution to this equation is Ct equals C0e minus Kt. Here, C0 is the initial concentration of the drug at t equals 0, and Ep minus Kt describes the exponential decline of drug concentration as time progresses. The negative exponent reflects the natural decay of the concentration. One key concept in first-order kinetics is the half-life, which is the time required for the drug concentration to decrease to half of its initial value. This is calculated using the formula T1/2 equals ln2k. What makes the half-life unique in first-order kinetics is that it remains constant regardless of the initial concentration, which simplifies dosing regimens and predictions about how long a drug will remain active in the body. On the graph, the exponential decline is clearly visible. The curve starts at C0, the initial concentration, and decreases smoothly over time. You'll notice evenly spaced markers along the time axis, showing where the concentration halves. This represents the half-life intervals. The steady slope of the curve highlights the proportional relationship between concentration and elimination rate. In zero-order kinetics, the rate of drug elimination remains constant regardless of the concentration of the drug in the body. This happens when the body's elimination pathways, such as enzymes or transport systems, are saturated and cannot process the drug faster. Unlike first-order kinetics, the elimination rate here does not depend on how much drug is present. The process is described by the equation dc dt equals minus k, where k represents the constant rate of elimination and the negative sign indicates that the concentration decreases steadily over time. The solution to this equation is C0 minus KT. Here, C0 is the initial drug concentration, KT represents the constant elimination rate multiplied by time, and the subtraction reflects the linear decrease in concentration. Unlike first-order kinetics, this decrease is not exponential but linear, meaning the same amount of drug is eliminated in each unit of time. Examples of zero-order kinetics include drugs like alcohol and aspirin at high doses. When elimination pathways are saturated, the drug is eliminated at a fixed rate, regardless of the concentration in the body. This can lead to drug accumulation and toxicity if doses are not carefully managed. On the graph, the concentration of the drug decreases in a straight line starting at C0. This linear pattern emphasizes that the same amount of drug is being eliminated over time, rather than a percentage. There is no half-life concept here, because the rate of elimination is not proportional to the concentration. The graph highlights how saturation can create a steady decline, but also presents risks if dosing exceeds the body's ability to eliminate the drug. Practical applications of pharmacokinetics. Pharmacokinetics plays a critical role in enhancing patient care and advancing drug development. One key application is personalized medicine, where drug therapies are tailored to individual patient needs, improving outcomes and reducing side effects. It also helps in optimizing drug therapies by adjusting doses and delivery methods based on a patient's unique pharmacokinetic profile, ensuring maximum treatment efficacy. Another important area is therapeutic drug monitoring, TDM, which involves regularly monitoring drug levels in the body to maintain effectiveness and minimize toxicity. This enables timely adjustments to dosing as needed. Pharmacokinetics is also vital in drug development and innovation, providing the foundation for designing better drugs, improving delivery systems, and maximizing therapeutic impact. Here's my references. Thank you for listening to my presentation.